A step-by-step demonstration on how to self-inject SAJAZIR. The following is a simulation for educational purposes. SAJAZIR should only be used when experiencing symptoms of a hereditary angioedema (HAE) attack. You should not inject SAJAZIR until you have been trained by your healthcare provider or a Vita clinical education manager. To arrange your one-to-one injection training, call today on 888-360-8482. SAJAZIR is an FDA-approved icatibant injection indicated for the treatment of acute attacks of hereditary angioedema, HAE, in adults aged 18 years and older. Please note, if you have an HAE attack of the throat, also known as a laryngeal attack, inject SAJAZIR and then go to the nearest hospital emergency room right away. Please see important safety information at the end of this video. For full prescribing information, please visit www.sajazir.com/PI. Tell your healthcare provider if you have any side effects. You are encouraged to report suspected side effects of SAJAZIR. Contact Cycle Pharmaceuticals Limited at 800-836-4380 or the FDA at 800-332-1088 or www.fda.gov/medwatch. We understand how important it is for you that in the event of an HAE attack, you have treatment on hand. That's why SAJAZIR comes in a pre-filled single-use syringe ready to go. Before you begin treatment with SAJAZIR, it's important you complete the one-to-one injection training with your healthcare provider or a Vita clinical education manager. The information provided in this video is designed to support, but not replace that training. Once you've been trained, having SAJAZIR with you will mean that you can use it to manage your HAE as soon as you feel the symptoms of an attack. Now, let's talk through the steps to injecting SAJAZIR one by one. By following these steps carefully, you will soon feel confident using SAJAZIR on your own. Before you get started, wash your hands with soap and water and handle any medicine and equipment carefully to avoid contamination. Now, open your SAJAZIR carton and remove the single-use pre-filled syringe and the needle. You're also going to need an alcohol wipe. This is not included in the box. Take a look at your syringe. The liquid inside should be clear and colorless. Don't use it if the liquid contains particles, is cloudy, or has an unusual color. Now, twist the needle cap lid to break the seal. The needle should remain inside the protective needle cap until ready to use. Then, remove the protective cap from the end of the pre-filled syringe by unscrewing the cap. Hold the syringe firmly. Carefully attach the needle to the pre-filled syringe containing the colorless SAJAZIR solution. Firmly screw the needle on the pre-filled syringe. Be careful not to remove the needle from the needle cap. Now you're ready to choose and prepare your injection site. The location for the injection should be a fold of skin on your stomach, about 2 to 4 inches below your belly button on either side. Make sure the location is at least 2 inches away from any scars. And do not choose an area that is bruised, swollen, or painful. Next, open your alcohol wipe, clean the injection site you have chosen, and then allow it to dry. That's the preparation part complete. Now you're ready for the next stage, injecting SAJAZIR. Remove the needle from the needle cap by holding the needle cap and carefully pulling the syringe. Do not pull up on the plunger. Pull the needle cap away from the syringe to reveal the needle. With one hand, hold the SAJAZIR pre-filled syringe between your fingers and thumb as shown. With your other hand, gently pinch the fold of skin you cleaned with the alcohol wipe. Hold the syringe between a 45 to 90 degree angle to your skin, with the needle facing the fold of skin you are holding. Bring the syringe to the fold of skin and quickly insert the needle into the skin fold. Slowly push down on the plunger for at least 30 seconds until there is no SAJAZIR left in the syringe. Release the fold of skin and gently pull the needle out. And that's the injection complete. Finally, you just need to discard the used syringe. Place your used SAJAZIR syringe with the needle attached in an FDA-cleared sharps disposal container right away after use. Do not throw away, dispose of loose needles and syringes in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of a heavy-duty plastic. This can be closed with a tight-fitting, puncture-resistant lid. Sharps should not be able to come out when the container is upright and stable. The container should also be leak-resistant and properly labeled to warn of hazardous waste inside the container. When your sharps disposal container is almost full, you will need to follow your community guidelines for the right way to dispose of your sharps disposal container. There may be state or local laws about how you should throw away used needles and syringes. For more information about safe sharps disposal and for specific information about sharps disposal in the state that you live in, go to the FDA's website at www.fda.gov/safe sharps disposal. And that's it. With its convenience and portable design and individual one-to-one injection training, you know that with SAJAZIR, control can be within easy reach. Important safety information. Laryngeal attacks can become life-threatening. If you have an HAE attack of the throat, laryngeal attack, inject SAJAZIR and then go to the nearest hospital emergency room right away. The most common side effects of SAJAZIR include redness, bruising, swelling, warmth, burning, itching, irritation, hives, numbness and pressure or pain at the injection site, fever, too much of an enzyme called transaminase in your blood, dizziness, nausea, headache, rash. These are not all of the possible side effects of SAJAZIR. Tell your healthcare provider if you have any side effects. Tell your healthcare provider if you have any other medical conditions, if you are breastfeeding or plan to breastfeed, or if you are pregnant or planning to become pregnant. SAJAZIR has not been evaluated in pregnant or nursing women. You and your healthcare provider will decide if SAJAZIR is right for you. Remember, if your symptoms continue or come back, you may repeat your SAJAZIR injection at least 6 hours apart. Do not use more than 3 doses of SAJAZIR in a 24-hour period. Tiredness, drowsiness, and dizziness can occur in people who take SAJAZIR. If this occurs, do not drive a car, use machinery, or do anything that needs you to be alert. Please see the full SAJAZIR prescribing information, including patient information at www.sajazir.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 800-836-4380 or the FDA at 800-332-1088 or www.fda.gov/medwatch. Always read the step-by-step instructions at the end of the patient information for information about the correct way to use SAJAZIR. Whatever you need, at every step of your HAE journey, you will find a friendly, familiar team waiting here at CycleVita for you, for life. So contact us with any questions you'd like to discuss on 888-360-8482 or visit www.cyclevita.life.